Oh,
Hello! Hi, Nugget!
this is him.
Hi, Nugget! The sleeping teddy bear, right?
Yes, that's him.
Hi,
He's like
Nugget!
angry right now because he wants food, but
Sorry, Nugget. We're going to borrow Dr. Vinh for a bit.
all right, see you later, Nugget.
Bye!
He ran away.
Okay. Dr. Vinh, thank you so
Uh,
much for being with us here tonight.
Thanks for having me. I've never done this live thing before,
I
so
know, I
yeah,
know. But did you have work today or no?
yeah, I did.
Well, thank you for spending your time with us after work. If you
Um,
could just introduce yourself to everybody.
my name is Vinh Vu, aka Vin's Castle. My username is Vin's Castle. There's a whole story behind that, but my name is Vinh Vu. I'm Vietnamese, not Filipino. Yeah, so I am 28 years old. I live in Cleveland, Ohio. Grew up in Oklahoma, but here I am. Yep, and I'm a third year resident in physical medicine and rehab at a program here in Cleveland. So, yep.
Yay. So when I started promoting our live, I'm so sorry for the thirst trapping everybody.
It's fine. This is my brand. This is what I do.
I know, I know. So you and I first connected also because of that viral Facebook post, right? So for those who don't
Yeah.
know, Vin got viral on Facebook in this Tries Filipino page, and they were posting your pictures in scrubs, and they were like Dr. Paturok. And for those who are not Filipino, Paturok means like to inject. So it was so funny. It was like tens and thousands of views, right? Of
Yeah.
likes and shares. On your YouTube channel, you've been dancing for years and years and years. How come not a dancer? How did this lead you to medicine?
Oh, like why not like professional dancing?
Yeah, like, did you always want to become a doctor? Or
Okay, well, all right. There, I mean, I guess there's a story. Well, I mean, not really, but I used to want to be a dancer. I used to want to be a professional dancer back in high school. So I grew up in Oklahoma. There's not much dancing. There's not much like a scene or anything. And I was like, okay, like the place to go is LA. So like in my head, like ABDC was going on, like
Mhm.
Jabwalkies, all these like people were like crews were everywhere, and then like YouTube, like body rock competition, vibe competition, like all these like big competitions were going around, and I'm like, that's where I want to be. So I wanted to be out in LA after I graduated high school. I'm like, I want to go out to college out there, like UCLA or something. I'll probably,
Mhm.
I don't know, make it whatever to whatever application. But then I don't know, like the more I thought about it, well, actually, I tried to apply, but I was like, never mind, because it was really expensive. Out of state was really expensive,
Mhm.
and like living out there was really expensive, and I didn't really know too many people, so I was like, yeah, I probably want to do that. So I ended up going to college in Oklahoma, and then I don't know, like my first thought in my head was like, I'll just go into medicine because that's what like Asian parents tell their kids
Yeah.
to do. And I was like, okay. Well, actually, I started out as like pre like physical therapy, but I didn't know
Mhm.
what that was. So I was like, I just want to work with muscles, bones, like stuff like that. But then I changed it to like medicine. I started volunteering a whole bunch and shadowing, and I was like, okay, I'll just get into medicine instead. It's a much more stable career because also like dance, it's like I mean I thought about like how long can you really go for? Maybe in your 30s, maybe your 40s, if you're pushing it 50s.
Yeah.
But then like what can you really do with that career? Open a studio, teach a team,
Mhm.
dance for an artist. Like I never wanted to dance for an artist. Like I never wanted to be like a background dancer. I never
Yeah.
wanted to like open a studio and like teach because then it's
Yeah.
like you're just making dances like over and
Yeah.
over. You're just teaching, teaching, teaching. And I was like, that's not for me. That's not what I want my future to be. Yeah, medicine's more stable.
Was there anyone in your family or your friends who were doctors that you were like, oh, I'm gonna be a doctor one day? Because it's like,
No, no.
wow, you
I
really
mean,
took the long road, did you? You took the hard road. I mean, you've
eh,
always been smart though. You're valedictorian in high school, so
yeah, it
it
was.
was not too far. No, it's not too far. Was there a personal experience that you were like, I wanted to go somewhere in like physical medicine, like even if it was like pre-PT in the past? Were you just always like into physical stuff, like working out? I mean, everyone is aware of how.
So okay, so physical medicine rehab, it's actually a pretty small, like not very well known specialty,
Mhm.
especially for like people who are not into medicine. You're just like,
Mhm.
okay, what is that? So I never knew what it was either. And like when I was into med school, like my first year, second year, even like third year of med school, like I'm, almost done with it. And I'm just like, I don't know what I like. It's chill, it's cool. Like I'll just do family medicine. But I mean, I've always liked everything that was like physically related. And then one of my roommates, who was like a year ahead of me, he was like, he was going into this field because he heard it from people. And then he's like, you know what, you should just do a rotation, just like try it out, see if you like it. I ended up doing it like a rotation. I ended up like really, really liking it. I mean, for those of you who don't really know what it is, long story short, it's like anything that physically can happen to you, you can come to us. So any kind of like force injuries, pain is a big one, spinal cord injuries, which is basically like if you're paralyzed, brain injuries, strokes is pretty common,
Mhm.
amputees, burns, fractures, anything like that.
Yeah.
We do a lot of like injections. If you watch my stories like recently, we do a lot of nerve conduction studies and
Yeah.
things like that. So anything physically
Yeah.
Happen to your muscles, bones, or nerves, like, yeah, we're the man.
But
We just
still,
don't.
it's
Yeah,
yeah, it's such a long road. And for those asking, you missed Nugget in the beginning.
yeah, he'll be
But
back.
still, like medicine is such a long road. And for those who don't know, like here in America, right, it's 4 years of undergrad, or
Yeah,
3 to 4 years undergrad, and 4 years of medical school, and then X however many years of residency.
4 for me, but yeah.
Or for you, it's such a long road. From the beginning, you weren't like, "Oh, this is too long. I'll do something else."
No, I mean time's never an issue, you know, like in my head, like time is just like it's just whatever's in your head. You know, like when I was like in college, you know, like you're 20, 21 years old, and then everyone's like when you look at older people like, man, that guy's 27, he's 28, he's old. Well, you're old because you act old, you know.
Yeah,
You're old because you think you're old.
yeah,
Like you're old when you say, no, I'm too tired, I'm too old for that. You know, in my head, I'm just like, I'm out here, I'm having fun. Like, you know,
yeah.
some of like my peers or people I know who are around like their late 20s, they're like, no, I'm just settled. I'm good. I just don't want to do anything. I'm like, dude, I feel younger than kids out here in college, you know?
Yeah,
More fun. Like this is everything's in your head. I don't know.
yeah, I
So
agree.
I
I
didn't
mean,
care about time, you know, because
yeah, I
I'm
mean,
still young. I
yeah,
look
you're
young.
28, so which
Yeah.
is pretty young to be a doctor, actually. So you don't have any regrets of entering this long and stressful field of medicine.
No, I
Uh,
you know I don't have any regrets. I love my decision. I love
mm,
my specialty. Yeah, I have a lot of
yeah.
fun. I have a
So
life outside medicine. So
as we are all aware, and if there's like a pre-med student watching who's unsure of this is the path for them, what would be your number one advice for that student?
well, it depends on what their concern is. Like if the concern is time, because I know a lot of people are worried about that. I mean, like I said, like you're gonna be in your 20s, you're gonna be young, like it's
Mm.
fine. I'm still going out, I'm still hanging out with my friends, I still go to like festivals, I
Yeah.
still go to like, you know, the club, the bars, like
Yeah.
if I want to, you know, I still travel if I want to. It's not like, oh no, you're gonna kill your 20s, you're not gonna get to hang out, party, be have friends. Like I do like whatever I want, you know.
Yeah.
I
And
don't
people always say, right?
get
Is
trying
that
to
is that Nugget? Hi Nugget.
yeah, trying to play.
Everyone, that's Nugget. Right? Like they
Um,
always say, oh, after my residency, I'll have fun. After my residency, I'll travel. Like the time is now, right? The
yeah,
time is now to it's like, oh, I'll wait until I become an attending, until
yeah,
after fellowship for me to do this or that. And like
yeah.
time is just passing you by and not doing the things that you want to do. How does a daily day in PMR residency look like? Like, is it in a clinic or do you also have rounds in the hospitals as well?
It's both. So clinic, there's a lot of variety. So you can have like a general clinic, like a general musculoskeletal clinic where it's just treating like musculoskeletal stuff, like nerve stuff. You know, like I got shoulder pain, like rotator cuff issues or arthritis, like knee pains, like hip pain.
Mm-hmm.
Back pain's a pretty big one. Keep in mind, we do everything we do is like non-operative because if you're gonna get surgery, like you're gonna go to a surgeon. We're not
Mm-hmm.
surgeons, so that's a clinic. So the clinic, you know, it's normal hours like 8 to 5, 9 to 5, or to 4. If you wanna, there's other clinics like there's a sports medicine clinics, pain management clinics. There's interventional pain clinics where you go in and then they put you under and they do this like fluoroscopy,
Yeah.
like injections in your spine and stuff. So those like general clinics. But then also like when we do like in the hospital stuff, it's either in a rehab hospital
Mm-hmm.
where basically it's not drug rehab, it's like
Yeah.
physical rehab, right? So basically the timeline goes, if something happens to you, you go to the ER and then you go in the hospital, they treat you, you get surgery, whatever you need. And then if you're still weak and you need some like strengthening or need to learn new skills or for whatever reason, then you go to rehab.
Mm-hmm.
And then so that's when we're at the rehab hospital and then we make sure they're like medically okay and we treat
Yeah.
them there. So like
Yeah.
they're pretty stable. So it's like
Yeah.
we're only there from like I don't know 9 to 3.
Yeah. It's also for like
um,
stroke patients, right? Who's like probably loss of like ADLs, and you'll be there to like help them support to regain all of that.
yeah, like all the medical management of it.
Yeah.
Yeah.
So how is that different from, let's say, a PT then?
So the PTs, the physical therapists, all the therapists, they'll do the actual exercises. You know, they spend like an hour or so with the patient. They'll take them through these exercises, but we don't do any exercises with them at all. We don't really teach any exercises or anything. We basically medically manage them. So like, let's say somebody who has easy examples like a spinal cord injury, which is basically they're paralyzed, whether they're completely paralyzed or just like partial paralyzation. The therapist can like do the exercise with them, whether if they can't use their legs more, like okay, well they'll teach them how to like maneuver around without their legs. So the therapist will teach them like certain things. But then we'll handle things like, because if you can imagine everything like from here down, like let's say it doesn't work,
Yeah.
people forget like, well, you can't poop right, you can't pee right, you have pain down there, like things are gonna happen. Your muscles are gonna like contract on their own. So we manage all that, we make sure they're like have their bowels okay, bladders okay, pain, spasticity. Sometimes their sleep and their mood are affected. There's a lot of other like medical things that we take care of instead.
Yeah, I think many people like tend to forget the quality of life that is lost, right? From let's say either an injury or even not just like a physical injury. I work in like a cardiac surgery unit, right? Sometimes it doesn't go too well. That's medicine, right? Not everything goes well or is planned, and they'll have to go to cardiac rehab. And a big part of that is physical medicine and rehab as well, making sure they regain what was lost per se. And like you said, like the whole psychosocial aspect of all of this. That being said, would you say that there's like a top 3 conditions or situations that, oh, this is the patient that I'm going to see today? Like you're going to the clinic and at the top of your mind, you're like, oh, for sure, at least one person had this, that.
Oh, clinic wise, it's back pain, back pain, back pain. That's pretty much it. Well, it's a lot of back pain, but other ones like other commons like shoulder pain, knee pain. That's pretty common.
Is there a trend of like how they got those back pains, or it's just like chronic?
It's both. Like we'll get like acute back pain. So the thing with physical medicine rehab, so it's like it's normally these people they go to like their primary care first, and they're like, oh, my back hurts, and then they treat them, and the primary care is like, well, okay, we'll give you certain types of pain meds or whatever, and then go to therapy. We'll get these imaging, and then they're like, okay, and then like, okay, oh, these don't work. Okay, fine, go get these like procedures, injection, and then if that doesn't work, they're like, we're kind of like the end of the straw, where it's like, okay, we've done all these things for the patient. Like, well, why are they not better? So then that's when we get like our patients most of the time. We tend to get the more like complex cases where like primary care did not, or they didn't know what else to do.
Yeah.
So it gets pretty complicated. Yeah. But like back pain, spine stuff, you can have like hip stuff that can affect your back and like tailbone stuff. And yeah, it's a lot.
And people are saying, as I'm sitting here with back pain, well, you gotta go to Ohio then. Everyone's been asking for Nuggets.
Yeah. He literally always wants to play with me, regardless of what I'm doing.
It's fine. It's a good view. So cute. So how long have you had Nugget for?
A little over a year. Yeah. Got him June 2020. Yeah.
Also, a lot of PMRs, they like lead on to like pure pain management, right? Like
you could, yeah.
Yeah, like pain management clinics. And also, like you said, like a lot of sports injury stuff. And I have talked to someone who now they're doing like DBD, it's like PRP even for the joints and stuff like that. So I think it's a very niche field as well. And like you said, it's quite a small group. Do you find it exciting every day to go to work?
Depends what my rotation is. Because the thing with like PM&R is it's extremely broad. Like the good thing is like not like, let's just say internal medicine or like, or let's say family medicine. It's like you either work in the clinic or you work in like, I mean, generally, you work in the clinic or you work in the hospital and you see like general type stuff. It's not like, well, if I want to practice in sports medicine, I'd have to go get some extra training. I got to do this, I got to do that. But if I want to just treat blood pressure, if I just want to treat like diabetes, you'd have to, somewhat have some kind of specialty like endocrine or cardiology. But then the good thing about PM&R is like we train so like broadly. It's like if you want to stop doing something and you're bored of it, you can just switch to another area. So like let's say like, oh, I just want to do a general like musculoskeletal clinic. I'll just treat like back pain, joint pain, like stuff like that. And okay, I can do that. And let's say like, well, I'm tired of that. I just want to do like nerve conduction studies. Okay, I can just go off and like do that. Well, I'm tired of that. Maybe I just want to do like some sort of like pain management. I mean, you still have to, some of those you still have to get like special training, but it's like at least you know how to do certain things. Or it's like, well, I just want to do like spinal cord injury or brain injury now, or just concussion clinic. That's all I want to do now. You can do all that if you want to, because like we're trained in like so many things. Or it's like, well, I'm tired of doing that. I'll just work in a rehab hospital, or I'll just do like consults at the hospital now, or I'll just work in a nursing home. And like you have so many options of what you want to do. So, I mean, it's pretty exciting. But I don't like everything. Like, I hate a spinal cord injury. I absolutely hate it.
It's a lot of work. Anything with the spinal cord scares me. Like, scares me. That's why I can never work in neuro. Sorry, neuro.
Yeah. They have a lot of stuff going on. It's a lot of social stuff we have to, like, handle. So it's tough. I didn't like it.
Is there one that you want to like do? Like, oh, this is my favorite so far.
I mean, I'll probably end up doing like general outpatient stuff, general musculoskeletal outpatient stuff. Maybe consults at the hospital. Yeah.
How's residency like? Right? We always hear, oh, you technically become a servant for 3 or 4 years, working 100 hours a week,
Yeah.
underpaid, while medical student loans are piling up,
Yeah.
and then all of this mean and rude attendings. Is that true? Is that how your life is as
Yeah,
a
well,
resident?
it is to an extent. It is depending on your specialty too. See, like I
Yeah.
picked a
Mm-hmm.
specialty, PM&R. So you know what they joke about, like what does PM&R stand for? So PM&R stands for paid money to relax, plenty of money and relaxation, whatever along those lines, right? So it's
Internal medicine is crying.
yeah, pretty much.
Yeah.
Anybody who looks at us is like, man, why didn't I know about this?
Yeah.
Yeah, because like, if you're internal medicine, if you're any kind of like surgery specialty, then like yeah, 100%, you're working like all these like crazy hours.
Yeah.
Like anytime you're in the hospital, like with acute patients, like yeah, you're working like all day long, pretty much. ER anywhere, but like physical medicine rehab, like I told you, none of our operations are emergent. You know, if something
Mm-hmm.
emergent happens, like that's not my job. I'll send you to the
Yeah.
ER.
True.
I'll
Yeah.
call like internal medicine to take care of you. You know, it's not like I get
Yeah.
to go home. Yeah, I get to go home
Shade.
at like 3 or 4 o'clock when I'm working in
Yeah.
the hospital. If they need me, they'll call me on the phone. You know, if something emergent happens, I'll be like, hey, send them to the ER. You know, because that's not my job. I'm not trained to like
Yeah.
do that. You know, so I mean, like I have a very good specialty. My
Yeah.
residency is actually pretty lucky because like yeah, we get to take calls from home and stuff like that. But I know
Wow.
some programs like bigger hospitals. There's another one here in Cleveland actually. Like they work like a lot more than us. And they're PM&R. Like they have to sleep at the
Oh,
hospital because they
oh.
don't have like other services to like back them up like we do. But I definitely work 100 hours a week.
Oh my gosh.
Sometimes
That's the thing. If there's any internal medicine resident watching here, they're probably like, because I know internal medicine friends are like sleeping in the hospital, always
yeah, because you
on
gotta
call.
sleep like overnight.
Yeah.
Yeah,
Yeah, it's like 48, 24, or 48-hour shifts. And you know how they always say, oh, in TikTok too, right? I forgot
yeah,
his name, the doctor, and he's always like making fun of different attendings from different specialties. And
yeah.
it's like
I've seen it.
neurosurgeon is like so mean, and surgery is like forget about it.
Yeah,
How is PM&R? How's the attendings like? Is it like, I don't want to call surgery toxic, but it's definitely not
and I
nice.
think they have a personality that
Yeah.
draws them in. Yeah, human are like you also have a certain personality. Most people, not
Mhm.
all of them, like they're pretty chill. It's like,
Mhm.
like all right, that's cool because nothing's like I said is like emergent. So
Yeah.
like you're
Yeah.
not always like antsy. You're not always like angry as life. You know, you get to sleep. You get to go home. You know, you have a life.
Yeah.
So it's like you don't have to be frustrated and stressed all the time. I mean, depends
Yeah.
where you work. Like, yeah, most of them are pretty nice. I've met a few attendings who were not so nice, but I don't know. You just deal with it and move
Yeah.
on.
What can you do as a resident, right?
Yeah,
Like,
as a student and resident, you just deal with it, and then that's it. You're only stuck with them for a month at a
yeah,
time.
yeah.
Yeah,
But you're a senior resident now, right? Do they count third year as senior residents,
yeah,
or yeah, they
yeah,
do? Wow. Do you think time flew since you started the medical route?
yeah. I mean, it definitely went by really fast. Like I'm already halfway through my residency. Yeah, yeah.
Yeah,
That's why I don't time. You know, like if it
yeah.
takes long, like I'm still young.
Like I saw you went to a festival like a month or a few weeks ago, and
With my
yeah,
resident.
and banging with the middle of the crowd. And that's one
Yeah,
thing actually that I wanted to talk about, especially because a presence on TikTok. Even your bio says it, right? Like, I just want to have fun. We talked about this like a month ago, I think. You posted something and someone was like not too happy with what you posted as a
yeah,
doctor. Do you think there's like a demarcation line between social media and medicine? Like, especially in Asian culture, right? In our culture,
yeah.
it's like prim and proper. You're demure. You're a doctor. You're a professional. White coat. And we talked about this. Like, you are the total opposite of what that
Yeah,
prim and proper
yeah,
doctor, the traditional doctor would look like, right? Like tattoo sleeve, sensual dances
yeah,
online, shirtless. How do you
yeah.
reconcile that? I guess like personally and also in general.
So, like that's exactly how my parents think too. Like they see my stuff.
Mhm.
My mom is always like, "Why are you doing that? Take that off." Like take the post off, not my shirt. And, like, but like yeah, like my parents are like that, and I know some people online are like that too. But like yeah, like, I mean, I like the way I live my life is like you
Mhm.
live and just be happy. Like you do whatever you want. Like you're not hurt if you're not harming anybody or yourself. Like I'm just out here having fun, you know. But I do have to like keep an eye on like
Yeah.
what I post, which I've learned over the years. You know, like
Mm-hmm.
at the very beginning when I was a med student, like I learned a lot as a med student. I was like, maybe I am getting in a little murky water here. And like I've gotten like, because there's one time in med school, I didn't think anything of it. I was shirtless and I posted a picture of my white coat, you know, and then like, you know, just having fun. And then like somebody like reported me to my school. They got on
Oh,
to me about it. And like they called me and like, hey, you need to take that down. I was like, oh, I didn't know. I didn't think about it. You know, like
mm,
so like little things have happened over time where I'm just like, oh yeah, you know, I didn't think about it. Cause I just have like a natural, like fun, like personality. But like, yeah, it's getting to the point where like some of my comments, I used to like respond like a little more like risque or like
yeah,
flirty or whatever or
yeah,
unprofessional maybe. You know, it used to be like
yeah,
because you know the type of comments I get like, oh hey, can I get a prostate exam? You know, and I joke back with it, you know.
yeah.
But nowadays it's like I realize like I can't do that type of stuff. That was
Mm,
back when I was in med school and I didn't know any better.
yeah.
Because nowadays it's like, okay, what if like my hospital saw this? What if the ethics community saw
Mm,
this? Or
mm,
what if somebody saw this? Like, it's probably not a good idea. You know, like if you say that in real life to me, it's different because it's like
yeah,
nobody's recording me, you know.
yeah,
I'm not in
yeah,
my uniform or
yeah.
whatever. Yes, I mean I definitely watch more of what I say or
Mm,
respond. Like it's because I've been reported a couple times.
oh,
Yeah,
yeah,
it's not fun.
yeah,
But then so I really watch like what I say and stuff like that, and I try to get in like at least professional about everything I do. But like the TikToks and stuff I do, I try to keep it like not confusing, where it's like you know like my doctor said that you know type of.
yeah,
Yeah, I mean it's tough, but I try to have fun, like have
yeah.
people like relate to me and whatnot. So
Yeah. But do you think it's like a new wave of medicine? Just from here on out, like it's just gonna be social media, right? Like we're never gonna go back to the early 2000s or 1990s. Do you think this is just how it's gonna be? The term physician, right?
uh,
I feel like society has placed so much emphasis on the image of it, right? As opposed to like just the pure work. Like I said, prim and proper, walking in the hallway with a white coat on and a suit and talking gently to patients, right? Which is, by the way, for those watching, that is that is not what happens in real life. This is not Grey's Anatomy. Do you think people just have to get used to? Oh, that's it. Like this is the new. This is our generation, right? Like coming with tattoos and piercings. I think my main question is: do you think the idea of a doctor should be more about the work as opposed to like physical? Because there's like in medical school, right? Even in nursing school, it's like, oh, can I have long nails? Can I have long hair? Can I have dyed hair to get into rotations? Do you think we should adapt to that, like as the new generation?
that's a big question. I mean, the thing is, I think the viewpoint of what people have is what they expect to be treated like if they're admitted into the hospital or going to the clinic. I mean, which is true because, like, I definitely don't really talk the way I do online as I do in the clinic. Like, I'm much more professional. I don't wear my earrings to work. You know,
Oh,
I mean, I'll wear like scrubs and I'll show my tattoo, but
mm-hmm.
like the way you behave at work is much different, and the way like because you know if you're like a same thing like if you're a police officer or if you're like a restaurant worker, that's just how you're expected to behave at work and professional, you know, and that's like normal. But then like I think what social media and everything else is portraying now is like what you're seeing is their life outside of medicine,
Yeah,
out of work, and like people forget like oh that's a real person too, because then like you don't realize like because like some people they go into the clinic like man like why is the doctor so late, why is he doing this, why is he doing that, why is he not answering my phone call, like all these
yeah,
sort of things, but like you forget like dude like I'm a person too, you know, I gotta go
yeah,
home, I got things I want to do at home, I don't want to be at work all day,
yeah,
you know, people forget that type of like thing because it's just like they're just so used to like this is all they see you is in the hospital and that's it,
yeah,
you know. Yeah, like you forget like oh police officers like people too, you know, like they
yeah,
joke around and do goofy silly things too, that's why people like all those videos of like police officers like dancing with like general public and stuff, you know. Yeah, so I mean I definitely I think it's becoming more acceptable, at least
yeah.
fine. But like, I mean, workplace is different.
Yeah.
But
Has anyone ever talked to you about like your tattoos? I know no one has, right?
like,
Like in a negative way.
had employees like talk to me. I mean, the only comments I get at work is like, "Oh, I like your
I like
tattoo," and that's it. Literally, either like patients, like nurses, hospital administration people. Like the only comments I get are like, "Oh, what do you have in your arm there?" And that's pretty much it.
yeah,
And, like no one has ever told me, "Hey, you need to cover that up."
yeah,
Or anything.
yeah.
So I mean, it really depends on I guess where you work too. Some places are more strict than others. I have some attendings who dye their hair blue.
Yeah, me too. I have one of the emergency attendings like rainbow hair. Yeah, and also online, right? Like most of the time, those who post those comments are
Yeah.
Nugget are faceless profiles, right? Like
Yeah.
no followers, username 999 something,
Yeah.
right? And yeah, I agree that there is a person outside of work. You doctor by profession, right? But like there is literally a life outside of work. I love it.
This is his famous post. Sorry,
Oh no.
you can keep talking. I'm
No,
listening.
no worries.
But
No
if people
worries.
want to see,
I love it. So no, I just can't forget your latest TikTok, right? Everyone
yeah,
was
yeah.
wait, is that a teddy bear? Is that
That's
a
the
teddy
bear.
bear?
That's the bear he like always.
I know. Oh, he does look like a teddy bear though. But yeah, right? Like
Yeah.
it's really different. Like I figured that no patient was probably like, oh, you should cover up your tattoo. It's literally online. Like online world is so different from for the most part. Some people just see what's online, right? Like there's literally something outside of social media. Like when you make these TikToks though, the ones that do get like a little bit of traction, like taking off the shirt or all those sensual dance moves. Do you have like a brainstorm process on like when you make a TikTok, like, oh, I'm gonna take off my shirt for this one, and then at the back of your mind, are you like, oh, I wonder what people will think, like professional wise, or you just like, I'll just post it?
Oh, like what goes on my head like about professionally wise when it comes to like any of those shirtless stuff, like the dancing stuff. Like in my head, like it's pure entertainment. Like if
Yeah,
you like industry or entertainment world, like it's just entertainment. Like people don't understand. Like even strippers, like they're there for entertainment. They're there for work. They're there for money. Like not every stripper wants to get like laid. By like
like,
out there. Just because
yeah,
dude does not mean like that's what they want to do. They really money. Same thing with like just because like you see somebody like dressing like seductively or something does not invite you like, oh hey, like, oh, I just want to get touched. So the same thing
yeah.
with videos of my like dancing because I just uploaded another like
I
TikTok.
saw,
But like to me it's just like I'm not inviting any like kind of unprofessionalism. Like it's just no problem watching Magic Mike. You have no problem like going to Vegas with your buddies. You have no problem like going to those like websites, on your
yeah.
this is why is this different? This is just entertainment. I don't act like this in front of my patients. I don't like, oh,
Mhm.
watch this. I don't say, hey, watch this video of me doing this. But like I've done like stage performances, right? And like this is what you do on stage. Like you perform.
Mhm.
This is like basically what social media is. Like you perform.
Yeah.
If you
Mhm.
don't perform, you don't entertain. Like nobody's gonna watch you. You
Yeah.
play the
I
game.
agree.
I mean, I enjoy it. I have fun, but yeah, but there's a separation because like if anyone talks to me about it, it's really just like this is just like entertainment. Like I'm not out here to like saying certain things, or I'm not doing on out in my underwear.
Yeah. And also how people receive it. It's not really most of the time what you intend, like when you're posting it, right? Like your intent is different from like how people perceive certain things.
Yeah,
Which is why I asked, like, for those videos, right? There are some thirsty comments in there, and we
yeah.
do have some thirsty comments in the chat as well. Like, honestly, when I started promoting and then I posted your TikTok video, the first thing that came to my mind is, wait, oh my gosh, I'm kind of nervous for the comments. I hope it's not too wild. Do those kind of comments bother you
No,
or no?
I don't know if I told you. Yeah, it's like anyone who asks me or anyone who like says that any kind of stuff like that, because I'll get like DMs and stuff like, oh, I hope I'm not offending you. Like literally,
Mm,
I'm out here. I have fun. I do whatever I want. You have fun
yeah,
whatever you want. As long as you're not like being inappropriate, like it's fine. Because like if you can joke to your friends, like because me and my friends like we'll all make these like jokes to each other, like then why can't like my online friends do the same thing?
yeah,
It's the same thing as long as you're not like pushing for it and you're not serious.
yeah.
It's like no, I really want you to like do that to me. Like come on, send me news. And I'm like, when people do say that kind of stuff, I'm like, dude, like I'll either like ignore them or something. But most of
Mm,
the time, people are just having fun. Yeah, like whatever thirsty comments are a form of jokes. Like I take it as a joke. I'm not offended.
yeah, yeah. That's good because some people do get bothered and annoyed by them.
Uh-huh.
How does your fiance take those comments though? I'm for sure she's them at least.
Let's just laugh at it. I mean, all the jokes. It's like I said, like it's like if me and my like guy buddies like we make like gay jokes to each other or something. I mean, like we'll all laugh. It's like all fun. Or like my fiance, she'll just laugh and she'll like, oh my gosh, type of thing. It's like that's how you're normally supposed to like react. You're not supposed to
Yeah,
like that type of stuff. Like if you are, just chill out. That's
yeah,
is serious. That's different. But yeah,
yeah. How do you balance it though, like being a doctor and social media, especially because you have a lot of traction in social media? You have like what 220K followers now. Wait, wasn't it just like last week you had like 140,000 or something?
Probably. I had less than two.
So
I got two
yeah,
week on TikTok and like, yeah.
just when we started promoting the live, what, last week, you were only like
Yeah.
150,000, and then now you're like 200
Yeah.
something. How do you balance that? Like, do you feel like, oh, I have this amount of followers, I have to post on this day, I have to post. People will be waiting for me to post. Does it become a responsibility now, or for you,
Uh,
it's still really just fun?
yes and no. Does give me more pressure because even on Instagram last year this time, like I didn't get 10,000 followers until like March this
Mm-hmm.
year, and like so since then I've gotten like I'm at like 18,000, which is like I didn't think it was gonna
Yeah.
like so things are just like growing fast for me, and like
Yeah.
there is a pressure to like oh man like I have to deliver now, like I'm like important now, like I'm not a guy with like 5,000 followers, like I mean, I still do whatever I want, but like TikTok stresses me more out than Instagram because Instagram, I actually have like I've taken a bunch of pics and I have them ready to upload whenever I want. TikTok, it's like I got to come up with something
Yeah.
that's like trendy. But I used to get stressed out more about it. But now, like if you look at my posting schedule on TikTok, like I have no schedule. Sometimes I take 2 weeks, sometimes I take a month, and it's like TikTok. I purely just do it for fun. I have an idea, I'll post. If I don't, I don't like I still get like a good amount of like traction. I mean, so like I try not to stress out myself with that.
Yeah. I mean, TikTok is a lot of work though, right? Like to edit the stuff and even like thinking of the video or whatnot.
Yeah.
Especially with Nugget, right? Like the last video where you were like doing the zoom in.
Oh yeah.
Oh my gosh. I'm telling you, Nugget is the true star, Vin.
And like I set my little table out in a place where I knew he was gonna lay because I put my clothes there because he lays on my clothes. And then like I just had it ready when he was sleeping.
He literally looks like his teddy bear, right?
Yeah.
How do you balance your time though? Like in general, someone just said it. He's a doctor, photographer, dancer, TikToker. Plus, you have a relationship. Your time management skills must be A plus, and residency too, especially.
So yeah, it's definitely tough. I mean, management since like high school, college, because I'm always juggling a bunch of stuff. And I think the thing about time management that people don't understand is that one, you got to prioritize. Like that's the easy thing. You're like, what's important? Okay, I got to get this done. I got to get that done. I think the thing people are not comfortable doing, and the thing people don't really realize, I mean, it's kind of like a secret, is you have to know how to sacrifice. Because it seems like I'm doing a lot of stuff, but like I also make a lot of sacrifices. Because for any one thing you do in your life, you have to have an equivalent sacrifice. So like I picked up martial arts like back in February. So for every day I go to martial arts, I have to sacrifice a day of dancing. Like way too tired. Like I spent 2+ hours at the dojo. Like I don't have time because I got to do other things. That's what people I feel like don't understand as much as they're just like, well, I just want to do this. I need to get this done. I need to get that done. But they're not willing to sacrifice. Like, well, if I want to eat healthy, it's not just I got to eat good food. I got to sacrifice going out to eat. If I go out to eat, I got to sacrifice like not ordering this, not ordering that. Sometimes when my friends hang out, I have to sacrifice not eating snacks with them, or instead of like drinking more beers, like maybe I'll sacrifice not drinking beers. It's stuff like that. Whereas like the thing, a lot of things I sacrifice is like, okay, well, you have to realize you got to sacrifice like your Netflix time. Just like, oh, I want to do this, I want to do that, but I also want to watch a show on Netflix. Well, pick what do you prioritize? Yeah, so that's like long story short. Yeah, sacrificing is a really big thing. And yeah, I make a lot of sacrifices to make things work. Yeah, and I go to the gym too. I never skip the gym unless I'm
Wait,
like,
how often do you go to the gym? You go every day?
no, I go 4 days a week and it's about an hour or less every time. You don't have to be in the gym for longer than an hour. Yeah.
Yeah. What's your favorite exercises when you work out?
If I had to if I had to pick my top three to do this and nothing else, squat, bench, and deadlift, that's it. If I had to pick two, it'd be squat and deadlift. If I had to pick one, it'd probably be deadlift. Yeah.
And someone was asking for your OnlyFans. It's actually in his bio.
Yeah.
If you go to his Instagram on the beacon link, right? It's the very last link. His OnlyFans is there.
You clicked on it since you mentioned it.
Yeah, it's a bit spicy, but it's OnlyFans. Oh my gosh. But probably we didn't talk about medicine at all. People won't think that you or I are in the healthcare field, right? And
Yeah.
I feel like this is the new wave of healthcare, of medicine, right? It's just people are becoming more in tune that, oh, we can actually have fun while we are professional. I mean, my mom, she's been a nurse for 30 years, and, it's demure, it's prim and proper, but here we are, our generation, right? Like going to the club, going to the bar. I know some residents who go to like the bar right after work. I mean, I have no idea where
Uh-huh.
they get the energy from, but
Yeah.
like, right, this is what it is. This is our generation. Does anyone have question? Or has anyone faked an injury or so just so they can get close to you?
No, actually, so
Oh, here
there
we
was
go.
one girl I got a DM from. She was like,
Oh,
"Hey, do you remember me? You treated me in the rehab hospital like a month or two ago." I was like, "What?" And like I was very suspicious because I was like, "I don't recognize your name at all." And like I don't remember all my patients, but at least I recognize the name.
yeah, the
And she was
name.
young, and I'm like, I would definitely recognize at least a young patient.
Yeah.
Most of our patients are not like in their 20s, and like she kept going at it, and I was like, okay, what hospital were you at? She's like, oh, I don't know, and like she was listing all this like BS stuff. I'm like, no, I was not at that hospital. By the way, I didn't tell her where I was. It was really weird. But she was like, can you be my primary care? Like, please, can you take care? And I'm like, no, I'm not even primary care. Yeah, it was really weird online. I just kept telling like, I think you got me mistaken by somebody else.
Oh my gosh. Or maybe it's it's something. Oh, I just want to see Dr. Vin. Someone asked, what determines you to do all this stuff? Yeah, where does the motivation come
Oh,
from?
where's my determination come from?
Yeah.
I mean, I think the biggest motivation for me is like progress and results. It's boring when you get no progress, when you see no results. Like, if honestly, like 100% honest, if I got like 10 views, 10 likes on every single thing I do, I'd quit doing everything I do. Like, there's no progress. Like, it's like going to the gym. Most people they go to the gym, they stay there for 6 months, and like, I have no progress. Like, why am I not getting bigger? Well, because you got to stay longer. You got to be consistent. But as soon as you get somebody in the gym who's like, wow, I'm seeing like progress. Like, I'm doing powerlifting. I'm seeing my numbers go up. Like, it's a big motivation, Or you look in the scale, like, man, my scale, like my weight's going down. Like, I'm looking better. Like, whenever you get this like progress and results, that's what I feel like is the biggest motivation. I mean, I don't know. You just got to work hard, and like eventually, like you'll get some kind of progress.
Yeah.
Yeah.
It's kind of like a fulfillment type of sensation, right?
Yeah. Like you have to make your milestones and make, yeah.
Someone said about the girl, oh, she was gonna lock you in her basement if you
If I
told.
told
Wait, have you ever met a follower though, like from TikTok or
Yes,
and
I did actually. Okay, so back in the day, I used to be big on YouTube, like whatever bigger meant. I mean, I only had like 6, 7,000 followers on YouTube, but I used to get like more traction there until YouTube changed. And then
yeah.
I used to go to Dallas a lot, and like the Asian community in Dallas was
Mhm.
big. So I would go to some places. People were like, "Oh, hey, are you Vin?" They would like ask to take a picture with me, or like I went to a restaurant one time. My waiter like, "Oh, hey, are you that guy from like YouTube? You do the videos?" I'm like, "Yeah," and like stuff like that. But the most recent one was it was kind of weird. I was on vacation in New Orleans, and I was like downtown somewhere. I was just walking. I was literally my whole family was waiting in line for like that pastry store, and then like they were waiting in line for me because I was on the other side of the road, and I crossed the road, and then my fiance was like, she heard this girl in front of us was like pointing at me, and she's like, "Hey, that's that guy from TikTok." That guy with like the tattoos from TikTok. And then I came over there and they were like getting real like, happy, freaking out, whatever. And I took a picture of them and I was like, how'd you know me, friend? And she was like, oh, I'm from TikTok from like that video you like flipped your dog.
Oh, yeah.
Yeah. So that was the
Uh,
most recent one.
while we're at it now, since we're talking about YouTube, can you just tell us the history of Vince Castle? Where did this come from?
The name itself?
Yeah,
Okay, so it has nothing to do with my name. So back
yeah.
then, channels, names were a thing. You wouldn't name your channel your name. You would name it something. So then, like me and my friends, we were like talking about it, and my friend he was pretty creative, and he like with names and stuff. And he's like, "Why don't you just name it like Vin's Castle? Like this is your castle, you know?" He's like, "A castle, like if you think about it, has a lot of wonders. You have like the ballroom, it's happy. You have the dungeon, it's sad. And you have like all these other areas of like different emotions." And at that time, it was like your dance videos can be happy, they can be sad, they can be like whatever. So he's like, "Why don't you make this your castle?" No, but it was cool. You put a Z instead of like a.
Vince,
I was like, okay. So then that's what I ended up doing. I would have
beautiful.
changed. And my
People know you by Vince Castle by now,
well,
so
I mean, definitely that. But then, like, the thing was, like, my friend who, like, he was, like, one of my best friends who, like, made up that name for me. He ended up passing away by accident. And I was like, yeah, I'm not changing this name.
yeah.
Yeah.
Wow. So there is some memory to that name because I've always thought, where's the castle? Where's the castle
Yeah.
coming from? Like Boo Castle. Boo does not mean castle.
It's a metaphor. It's like, this is
Yeah.
my castle. The Z just looks cool, but this is
Vince.
my castle. So.
Yeah. It's a very early YouTube type name, right? Why do physicians' skin are all clear regardless of how stressful it is? Well, guess what? They can prescribe
Skincare. Yeah. Skincare.
skincare. What is your skincare? Do you have a skincare?
Okay.
Don't
Wash my
tell me it's just a bar soap and that's it.
It'll be pretty quick. So wash face twice a day. So face wash, and then I put on like a toner, a serum, and a moisturizer. Random brands.
Random brand.
Random brands.
Blessed skin. Is there something that you've dreamt of doing for a long time, and why haven't you done it? Actually, I wanted to link into this question. Before, right, dancing was, I guess, not so practical because it's hard, blah blah blah. Now that you have traction, do you have plans one day of like, oh, I have a following now, maybe I can pursue dancing? Has that ever crossed your mind, or no, it's medicine here on out?
No, it's not dancing anymore. It's like it's different. I used to want to be like all this and that and dancing, and then last year I had a lot of fun with all the online stuff because of COVID. But like I don't know, I've thought about it a lot within the past couple months. It's just my goals are different now with dancing. I used to want to be part of a team. I used to want to be part of like dance with this, dance with that person, and like do stuff like that. But now it's just I don't know. Like I would never pursue it. Like why? Why would I want to dance for somebody else? Like I like doing whatever I want to do. Like which is making whatever videos I make. So like, I would never I don't know pursue anything else other than like whatever I'm already doing. I mean I've been getting a lot into like martial arts, like jujitsu and stuff. So that's like more of a thing that you might see of. I don't know. But that's not like entertainment. That's just like for me.
Yeah. And also it's like it could be a hobby, right? Outside. It doesn't have to be the main career or so. Doc, can you be my doctor when I'm giving birth? Oh my gosh.
Bro, I'm not an OB guy. You let me in the drink. That's it.
There's always those questions, right? How do you survive school? How did you survive med school?
The secret to survival is you can't study 24/7. If you go to class, hypothetically, you go to class 8 to 3 some days, eight to 5 some days. You don't have any extracurriculars. You don't have anything else. Like, what are you gonna do from 5 until like let's say you sleep at 12 for 7 hours? What are you gonna do for 7 hours? Study? Like, are you crazy? Like I would never study for 7 hours. Like maybe study for like 3 or 4. But if you study for like let's say even 4 hours, you still have like 3 hours left. What are you gonna do for 3 hours a day? Why don't you take an hour, go to the gym, and then relax for the rest of the 2 hours. Yeah, you got to have something else.
Yeah, and the retention goes down like the longer you are studying. So it's good to like, go out and refresh your brain a bit. What's your workout routine? 4 days a week, right?
Yeah, I go 4 days a week. Monday, Tuesday, Thursday, Friday. I've been doing that for years. I like it better that way. If I go somewhere on the weekends, like it's free, I don't have to work out Saturday, Sunday. If I have to go out somewhere Friday, Saturday, Sunday, I can always like shift my workout days around because I only go 4 days a week. 5 days a week, it's harder to shift around because if you want to make up certain days, any more than 4 days, I feel like it's hard. So that's why I go 4 days.
Do you ever work out like after work or?
Well, yeah. I mean, I go home and then I rest for a bit. My friend. Once you get on a program, if you're going there not knowing what to do, you're gonna get bored, you're gonna get confused, and you're gonna quit.
You are featured in a Filipino thirst page. That's what you're talking about. How did you take this, or did it affected you? And then one way or another. So basically, what people are asking was, can we feature you again in another thirst page?
Dr. Paturok or something, right?
Dr. Paturok.
Am I saying it right?
That was so funny, and all the comments too. Oh my gosh.
I told my Filipino friend, can you read this for me? I just want to laugh. It's so funny.
Oh my gosh. It was so viral. Oh my goodness.
Traction for me is a good thing. Like, you're not saying like something explicitly negative about me. It's fine. Yeah. I enjoy it. I appreciate it.
Yeah. What's the milestone you're working towards right now in your personal and professional life? Finishing residency.
Yeah, I mean, I have a lot of milestones. Like I always have the thing with me is like I always have goals. I always have things I want to do. Because if you never look forward to what you want to do, then what are you doing? You're in the same spot. So a couple of things for me. Of course, like get through my like EMG rotations, which is like the nerve conduction study stuff. I have 3 months straight of that. So I mean, that's like in residency wise, that's what I want to do. Dancing wise, I still got to figure out what I want to do with dancing. I mean, because I've been dancing less, but I need to be dancing more. I want to be dancing more. I don't really have any clear goals with milestones with that yet. Jiu-jitsu wise or martial arts wise, I need to be sparring more, but I don't get off work early enough. But I learn a specific set of moves and skills that is too much info for you guys. That's like those milestones. What else do I do? I have a lot of gym goals I have right now too, because I'm on a powerlifting program. I have certain numbers I want to be hitting at the end of this program. Yeah, in like 6 weeks or 7 weeks or something.
Doing it all. Wait, for your dances, do you like choreograph most of them, or?
I choreograph some, but I tend to learn a lot more than I choreograph because it's better for social media that way. As in, like, it's like taking a class. I mean, it's helpful because it's like you're taking a class, but then
Yeah.
instead of class and then them recording you, I take a class online. I record myself, and it's faster. I can get more out that way.
Yeah.
Yeah, so it's like a win-win. So
The one you posted earlier was from like a long time ago, right? Like years ago.
yeah, I originally made it in 2014. That was one of like my most viewed videos, like way back, like in YouTube. I mean, it has like 40,000 views, which was a lot for me back then. Which was one of my most viewed back then. That dance had a lot of meaning for me, like during that time of my life, and that was one of the first times I came up with this like stripping move. So yeah.
And there was one video on TikTok, right, when someone asked, "Oh, can you do a tutorial of how you do that? How you take out that shirt?" Right?
Yeah, it's pretty easy. All you gotta, I mean, I don't have a sleeve on now, but like you just pull the sleeve from the outside, not from the inside, right? You pull the sleeve and you twist it around and you just pull it up. Like if I had this, you just twist it around and tuck it in, and then you just pull it
And
out,
boom.
and it just
Yeah.
comes out. That's
You know, the truth is, they really didn't want to learn how to do it. They just wanted to, they just wanted to see the result.
so.
Like you said, 40,000 views before was a lot, but now it's like what, millions on TikTok, millions and
I mean,
millions.
40,000 on YouTube is a lot for me. I barely get
Yeah,
anything. I mean, anything's a lot for me right now. Like I don't know, I get happy like whatever I get. So yeah.
Chris, you should demonstrate. I am not demonstrating anything. Thank you very much. How do you manage burnout?
I mean, the same thing with like med school. Like, you just gotta have time for yourself. You gotta have time for fun. You know, you gotta know when to call it quits. You gotta know when enough is enough. You have to know when like you're working too much, you're doing too much. There was a time when I was there. I mean, there are certain times where like I just want to get things done. You know, so like I'll be working out a bunch. I'll be dancing on the same day, and sometimes I'll even go to like the dojo on the same day. And I'm like trying to like catch up on like YouTube stuff. I'm trying to like study for residency stuff. Like I'm just like trying to do a lot of things. Eventually like it catches up and it's like you just gotta, like I said, go back, like you gotta make some sacrifices. Like you can't try to do everything, you know. Even though I try to, it's tougher than it really is. But yeah,
Yeah,
you gotta cut out some things and just like make some time to relax. Yeah.
yeah. That sacrificial part is so important. Like this, you literally can like harbor everything in, right? And
Yeah.
you literally will burn out. What is something you love now that you never could have imagined you would like in the past?
Brazilian jiu-jitsu. So I didn't realize that. So I used to do martial arts when I was in high school, like two and a half,
Mhm.
like a mixed martial arts type of thing. I got back into it in February, just for fun. And then I don't know. Now I'm like hoping I can compete sometime next
Mm,
year. If I do, it would be next year. Yeah. So because I had a little bit of experience when I was younger, and I've been out of
mm.
it for like 10 years. But I'm like really getting back into it now. And I've done pretty well at my dojo, like rolling around with people. So
Rolling
yeah,
around.
yeah. I mean
But
that's
you
what.
take your fiance too, right? And like just roll her around the floor.
I mean, she does it too. No, I'm like one of the smaller guys in my gym, believe it or not. So I have to roll with like guys who are like 40, 50 pounds heavier than me. And I've like won like, handful of times. So I'm like, okay, maybe I'll compete next year. So I don't know.
How do you deal with hate and negativity from other people? I think this is different from like people who are trying to report you. Just like there's some comments who's just pure hate. Like
Yeah.
do you block those or do you comment back? Like no.
No, like so one is like I've learned to like you don't give them any attention, you know. One is like so I don't comment back. I don't really block them because like if they want to
Mhm.
watch stuff like whatever, unless they say something weird, like some people will say like I'm gonna report you, I'll block them, you know.
Yeah.
I mean, some hate comments are like they're like, man, like people really think that or something. But then like I mean, most of the ones on like TikTok, if you click on their profile, half of them are kids. You're like younger than 8 years
Yeah.
old kids. So it's like whatever,
Like,
you're
go to school, please.
yeah. So, I mean, it's like whatever. It's like a little kid dissing you. Like you're gonna get mad about that. No. But then like when there's like real people who are like I don't know me like
Mhm.
our age and
Mhm.
like trying to like hate on me. I mean, I just think about it. Like if you really think about it, like in such a positive video, I got nothing wrong with my video. You know, like
Yeah.
previous videos, like even with Nugget that I've uploaded on TikTok, like there's nothing wrong with it. You know.
Yeah.
But then I still got like a handful of like hate comments. But it's like if you really think about it, like would you like what would it take for someone to be so like frustrated that
Mhm.
feel the need to find something wrong with the video, you know?
Yeah.
So, but like, who gets frustrated like that? People who are like stressed in their life, like hate their life, they got things going on, they hate their job, they hate their friends, their family, like whatever going on. So, like, I mean, the end of the day, it's like they got stuff going on in their life. They had to find some hate somewhere to make them feel better. So I'm just like, whatever.
There's like a quote saying like some people are just like garbage trucks and they just want to throw that garbage out to other people.
Yeah.
Are you part Filipino or Vietnamese? Dr. Paturok is Vietnamese.
Yeah.
People always think you're Filipino, right? I wonder why.
Yeah. Because I probably have Castle as my last name or last name. Actually, I used to have Vin Vu on my like Instagram, and just Vince Castle is the username. Like going back to when we
Uh-huh.
talked, I changed it after I was trying to hide from residency programs when I was
Yeah.
applying. Like, I don't want residency programs looking up my name and seeing my stuff. So
Yeah.
I changed Vince Castle, but I just kept it that way afterward.
Only 24 hours a day. By the way, how many hours do you sleep? He's a resident. He does not sleep.
6 or 7 hours. Yeah, I need to sleep more, but I don't know. I sleep like 6, 7 hours.
Me too. People are saying he's Filipino. You should do a DNA test. No, honestly, Vu is a very Vietnamese last name.
My parents are very Vietnamese.
For
Yeah,
sure.
war and everything. Yeah, I'm Vietnamese. See, if I was
Oh,
Filipino, I'd be talented because Filipino people are actually really talented. Yeah,
karaoke.
yeah,
I think that's also why people think you're Filipino because like you like to dance. There's a lot of Filipinos that like to dance, right? It's like
yeah,
even YouTuber like Brian, right? He's
yeah.
Filipinos. I guess people are thinking you are a full Filipino. Wait, but has any of your patients been like, oh, I know you from TikTok or I've seen your TikTok videos?
No, my patients are like 50, 60, 70,
Oh,
80. They're not on TikTok.
they're not
But
on TikTok.
I have showed my patients my videos before. Like if we make a really good connection
Yeah.
and they're in the hospital and I see them like every day for like 2, 3 weeks or something, and we have this type of connection, I'll be like, hey, you want to see a funny video? And I've showed them my TikToks and like they enjoy it, you know? So
It is very enjoyable. I think people are enjoying our talk and Nugget on the side.
yeah, he's gone. I don't know where Nugget. I don't know where he is.
Does he wake up like late at night and or just sleep throughout the whole
Sleeps at
time?
30 and when he wants to go out. AM.
Oh wow. You're glowing, they're saying.
It's the lighting. I don't know.
The lighting is the lighting. No, it's natural though. If you have other questions for Vin, like if you're in the Olympics, what sports would you choose?
Like if I had another special like skill that I don't have right now, I would pick gymnastics.
I knew it. I knew
Yeah.
it.
I wish I could flip around and do all that stuff. That's what I want to do. But I don't have time for that. Like that.
You can do stunts though from dancing, right? Like I know you were doing like tutorials for like the flips and
B-boying stuff. I used to do
people.
B-boying stuff, but not anymore. I can't do any other flips or tricks.
Not anymore. You can't.
No.
Did you ever feel lost in your life path? How did you find your way again?
Well, it depends what you mean by loss. Like losses in like I didn't know what to do with my life. Losses in like I didn't know like my identity, friends group, or career wise. Or what do you mean by lost?
Yeah, has you ever been torn between two careers? Is that what you're asking? Christian, you can teach him. Oh no. I don't think you have seen Vince dance videos. Yeah, I'll get crushed. Oh my
Learn that
goodness.
stripping move. That's all you need.
Please, you know what? I think that's what you need to do. A for tutorial video.
Yeah.
I'll teach him gymnastics because he used to do gymnastics.
I
Yeah.
could backflip. That'd be nice. But I don't.
Oh, I lost it. But you can do like all of those other b-boy stuff. So
It's been a very long time.
in a very long time. Oh,
Very
those. I mean, the one that had a lot of views too, right? Was from like almost 10 years ago.
Oh, those tutorials. Yeah.
Yeah, I'm on the Doctors in Grey's Anatomy. Have you ever watched Grey's Anatomy?
No, I've seen clips of it and I cannot stand it. It's way too
Me
dramatic.
too.
People don't act
Me,
like real life.
me too. I've never watched a single full episode of Grey's Anatomy as well at all. Like,
I do plan on watching Doctor Death. I don't know if you guys heard of that.
which one? Or what?
Doctor Death.
I've only watched The Good Doctor.
Oh
Before.
no, I couldn't stand that one either.
I've only watched I think the first episode, the first season.
Yeah, I watched the first episode and it was a no.
In and out.
It was way too dramatic. Like he knew too much. Like doctors don't know that. Like if you collapse,
He knew too much, right?
actually, well, it's kind of funny. So like, you know, when you go in public, especially in an airplane, sometimes people are like, "Is there a doctor around or something?" That's what happened to me like 2 weeks ago when I was coming back home from San Diego. And I was so happy I didn't have my scrubs on because like somebody's like, "Hey, is there a doctor on the plane?" And I was like, I kept my headphones on. I'm like, "Okay, please do not say anything. Nobody, please say anything." Because like the thing like with me is like that's not my specialty. I don't have to deal with
Yeah,
that. And then
yeah,
even if like somebody was like feeling like I don't know like bad or whatever you're right like sick, like what am I gonna do? Like I don't have my like medications to give. I don't have any imaging. I don't have any labs. Like that's what I
yeah,
work with, and that's not even my
yeah.
specialty. So
Yeah.
I wish I could help, but
Oh my gosh, like that's always been my, that's why I also don't like wearing my scrubs in public, especially
yeah.
here in the subway in New York City. I'm like, if someone falls down to the ground,
Oh
I'm gonna
no,
have to.
dude, it.
Well, looks like I'm at. That's where I will use that shirt technique.
Yeah.
Take out the
Yeah.
scrubs. Not today. Never
Yeah,
wash
their
face
best
again.
bet is calling 911 anyway, like that. Because
Yeah.
so yeah, so I've had a lot of like attendings who are like who have been involved in like random public cases, and
Mhm.
like half the time like you end up getting sued for some like BS reason, and like
Yeah.
you end up like risking losing your license. Just you
Yeah.
try to save one person, but then like now your whole entire clinic of like a couple thousand people are like doctorless without you. So like, are you really
Yeah.
doing any good?
Yeah.
So
And the
like
first thing you'll do is to call 911 anyways,
yeah.
right? Like even in
Yeah.
the plane, you'll call the doctor down in land for the
Yeah,
instruction.
or they should have like medical personnel on the plane, just like they have like security on the plane. It I don't know, but
Yeah.
yeah, I've been advised to not get involved in like public cases
Yeah.
and just call
Yeah.
911.
Code Black is a good show, no sex scene. Are you throwing shade at Grey's Anatomy where every episode is? Let me tell you, everyone, no romance happens in the hospital. There's no steamy romance. First of all, there is no room to
There's the
do
call
any
room.
of that. Except for the call room, probably.
Actually, there was a I think there's a yeah, like I've heard stories of like my attendings telling me like this resident used to like sleep with other staff or something, or he slept with a patient. Like he treated the patient in the ER, and then like the patient went home, but then they actually went to the call room together, to get it on. But then eventually he got fired. Um,
For sure. Oh my
yeah,
goodness.
it's weird. Like I've never
But,
do
oh
that.
my God. So the new home is the call room. They saw a bed and they were like, "This is my new."
Yeah, like it's private.
Hi, Vin. Where are you from?
Where am I originally from? My parents from Vietnam. I was born in Texas, grew up in Oklahoma City, and then I randomly landed in Cleveland, Ohio for my residency. So I live in Cleveland, Ohio.
Was it hard moving? Like when you got match day, it's like, oh, you're going to Ohio.
It was weird. It was like, man, like I didn't think I'd get Ohio. Like I really wanted to be down like south, like in Texas or like Kansas, like somewhere closer to home. Yeah, I don't know how I got here, but I did. And it was pretty surprising for me. It was away from all my family and stuff. People were sad and crying and whatnot. And it wasn't too bad. Like, yeah, I'm a lone wolf sometimes. I like to do things by myself, so I was okay.
Chris, you look like someone from the Philippines. Well, I am part Filipino.
After I got posted on that like Filipino page, well, I look at like my stats like on Instagram. Like
All Filipino.
almost everybody, well, not everybody, but like I have like a gigantic surge of like Filipino followers, like from Philippines. I mean, which is cool. But then like a lot of them are like, "When are you gonna visit? When are you gonna visit? I'll take you around. I'll take you around." I'm like, I don't know.
You know, when you posted the countdown on your story last night, right?
Yeah.
And when someone like clicks it to get notified, I can see who clicks it
Oh really?
too. And there's like 100 people who click turn on the reminders from the countdown.
Yeah.
And I checked all of them. Each one had the Philippine flag on their bio, and I'm like, I knew it. All of these people are coming from the Dr. Paturok post.
Yeah.
And Donick G, yes, I do have Filipino blood. It's Vin, who don't have any Filipino blood,
Yeah, I'm Vietnamese.
as we think as of right now. And but
I
yes,
would visit Philippines. Oh, hey, here's Nugget.
yeah.
He
Hey,
would
nice.
randomly try to come play with me.
So
He can
now,
catch. He can catch it too. Let's see.
okay, we
Ready?
got it.
Oh no, he doesn't even want to catch it.
He
Never
doesn't.
mind.
Just like,
Um, but
but Donick G, yeah, I'm part Filipino. Well, mostly actually.
if I do visit one day, I don't know. I think it'd be fun.
It's all beaches actually. Oh wait, people are asking, is your friend group and girlfriend from your residency or?
My fiance, no, she moved up here last year with me, so no, she's not in medicine. My friend group here in Cleveland, I mean, yeah, they're all in my
Yeah,
residency.
because you weren't from
Just
there.
because like I didn't know anybody who whenever like I moved here. So yeah, they're some of my best friends here. We all hang out. We go like travel and festival and stuff together. So
I know. Come to see now everyone's gonna say come to Brazil, come to UK, come to
You need to buy me a ticket.
yeah.
Come on.
Buy me a ticket. I'd love to be able to pay for both of you to visit Australia. Well done.
I have an aunt that lives in Australia. Do you face challenges to be with someone who is in the medical field unless she is in another capacity? No, I mean, just normal couples challenges, you know. It's probably better that she's not in medicine because then I
Yeah.
feel like people butt heads. I don't know. I feel like you would have both have like somewhat of a big, I don't know, busy schedule. So I don't know. But I don't really care. I mean, same capacity as in like same like intelligence level. I mean, I think we're the same. So yeah. Would I work out with a fan in Oklahoma? Yes. Yes, I would. I would literally work out with like anybody as long as it's not like a big party. If you get me to a gym member, like if you get me to a gym that we can work out in, I would definitely work out. You just gotta DM me. Honestly, if I visit any city and you want to see me, like you just have to like meet me where I am, and but just like DM me. But I may or may not like I may have plans, so I may not go out of the way, you know, to find you. But yeah, but in Oklahoma's my hometown. So when I visit my parents, then yes. How many tattoos do I have? Oh, hold on. I mean, I just have this whole entire sleeve. I was going to make a video about it. I've been pretty lazy lately.
It's just a sleeve?
Yeah, this is all I have. I plan on getting another one, at least on my chest, on this other side. Probably extending this out at least until my traps area or something. Anyway, but real quick tour before I make a video about it. This is the one. It's like an angel with this like Cairo thing. I got this. This is my very first tattoo when I was like 19. So it's like American traditional. If I go back, I wouldn't pick this style now because it's not the style I have anywhere else. That's just because I'm Catholic. There's like a rosary there. On the back side, it's like my second one. I went to the same artist. It's basically like the three crosses. So I'm Catholic, and that's like the crucifixion. And then those are when I was in like 19 and 20. And then in like 2015, well, 6 years ago, so I guess I was in med school. 22, I got these roses right here, and then like this whole inner side, which is like a face with a clock. This is from like my two friends that passed away. That was kind of mentioning a little bit earlier. Yeah, we pretty much grew up like together, and then they got a real bad car accident. So each rose is for them, like one for each of them. And then the clock is like the time or like the date. Face has like a hand on it. Oh, I don't know if you can see it. Yeah, there it is. Okay, there's a hand on the face, on the real side of the face, because it's half skull, half not, and it's two teardrops, one for each of them. But the half face, half not is like hand is like holding a face, like it's a mask over the skull, because essentially like I didn't have to like mask myself when I was around them. There's also like a life and death, like have a contrast. So that was in 2015. And then 2020 up until like March this year, I got all of this done. So this is medical themed, but it's like very abstract. So this is like the patient side. So she's blindfolded because like patients who come to us are usually like if they're paralyzed or have a stroke, they can't move their arm or leg. It's like, okay, like what do I do with my life? So essentially they're like kind of blind, or they have this chain where like they feel like trapped, like okay, like I don't know what to do. But we have this like axe, which is like a foundation instrument or like device where like we build a foundation for them for a lot of it. So we break the chain for them that they feel bound in, right? So that's why the chain is like broken. And then the snake around the sword is that same snake around this like the medical symbol. But then like the sword is a samurai sword because if you know samurais and like they live by like what they call like a Bushido code, it basically means like they live to serve. So that's like the whole theme.
That's beautiful.
Yeah, it took a lot of thought, like coming up with something.
The meaning behind those tattoos.
Yeah.
Oh my goodness, it's amazing. No, like you literally have to make like a video for that.
Yeah.
Even though we have the first exclusive here.
Yeah, there you go. The first tour right now.
Yeah, it's amazing. Also, find out they said love the details on the last tattoo. Thank you for telling the stories behind your tattoo. You're a gem, Vinh.
Thank you.
So cute, Nugget. I'm telling you, Nugget. Come on, Nugget. It's like you've been on the phone for too long.
Oh, no, he really wants me to play with him.
You think you can catch it?
Oh no, let's see if he can catch from the camera. Catch.
Catch.
Oh, he did not want. Okay.
Every time the toy squeak, my cat goes.
Oh, it's kind of funny if you turn on like dog videos or I guess cat videos on YouTube, or like if I do it, like Nugget will literally just stare at the screen. He'll be like,
"Oh really?"
Yeah, like they'll play like squeaky sounds and like birds and like babies crying and stuff like that, and like they'll just stare at the screen. It's kind of funny.
Can you flex, Vin? Oh, you missed it. He did
Like
it
like this.
again. Oh, he's
This is
flexing
it. This is
again.
all I got. All right. This is all I got.
I literally have like a stick here. No.
You got some underneath.
No.
You never know.
Huh?
You got something underneath. You never know.
Of this? Oh Lord. Oh no. But thank you so much. This has been so fun. It's like almost 2 hours. I love it. I'm so happy that we were able to do this.
I mean, thanks for having me. I had a lot of fun. So
Thank you. Hopefully, we can do this again another time because I know a lot of people still have questions in the future.
in the future we can. We'll plan something.
We will.
All
Everybody
right.
will plan something. They're probably gonna watch it just for the flex, and they're gonna just still it and
Watch it as a podcast. That's probably the you just
honestly
leave
watch
it playing in the background, and when you're doing something, that's it.
That's it. Good night. Say good night to
Good night.
Nugget. Good night, Nugget. Good night.